Hello, everybody. Andrea Twarowski here with Dentalelle Mobile Hygiene. So I saw a patient the other day who hadn't been in about 5 years. So they had not had their teeth cleaned in 5 years, but it was because they said that they had a bad experience with their last appointment somewhere else where they were just in a lot of pain. So they did have their teeth cleaned, but just afterwards they were in a lot of pain. They said that just overall the appointment didn't go well. The office was behind. He kind of felt that he didn't really get a lot of his questions answered, and he felt like he was just a number where he was, in, out, that's it. They didn't call him to, see if he was doing okay after his cleaning appointment, things like that. So he just said to me, I felt like I was a number, and he was actually referred to me by somebody else, which is excellent. So I love that. But as you guys can see here, so this is a good example of how your teeth will look after 5 years. Now, this could actually happen after a year, 2 years, 10 years. Everybody's different. So what you see in the first picture here is plaque and tartar, even stain. So you see that kind of like yellow brown, I guess, areas like on the bottom of the teeth here. And this is your lower teeth on the inside. So right at the front, here's the lip, and your tongue is, the tongue is pushed up a little bit here. But this is plaque and tartar. So this is not healthy because remember how I said that plaque harbors a lot of bacteria. So plaque pretty much forms right away after eating, drinking, anything. And then after 12 to 24 hours, plaque becomes hard and then forms tartar, forms calculus. So each of those two terms mean the same thing. And tartar and calculus, you cannot take off with your toothbrush. So that is why he needed to come in to have his teeth cleaned, because he wanted all of this off. So look at the after. Look how amazing that looks, right? Amazing. Stain is not there. Plaque, not there. The tartar, the calculus is not there. And this does not have to be sore. So even if it's been 2 years since you had your teeth cleaned, 2 years, 10 years even, things do not have to be sore. It all depends on, taking your time, or, me taking my time. Something like this may even take 2 appointments. It depends on the person, but taking our time, and I also have a numbing agent that I can apply just sort of underneath the gums along here, so then that way it's not sore at all. And the numbing agent lasts 45 minutes to an hour at the most. So right after the appointment, your teeth, your mouth is back to normal. You can eat, drink, anything. So it's perfect. But look how nice this looks before and after. So something like this would take about 2 appointments. But that's it. Now that things are nice and clean, I'm thinking this person can come in maybe every 4 months or so, because they tend to build up stain quite quickly. If you drink a lot of wine, coffee, if you smoke as well, I lost my train of thought there. If you smoke as well, then that can build up stains. So you might have to come in more often than every 6 months. But this person, I'd say every 4 months, at least until things are nice and healthy again. Because this takes time. This takes time, but it does not have to be sore. So even if you haven't seen a dental hygienist in 10 years, that is okay. Come to see me. I am so happy to help, and you will actually like having your teeth cleaned again. So let me know if you have any questions, and thank you so much for watching.